I'm Dr. Fergal Armstrong. Withdrawal is one of the most feared aspects of addiction and one of the most misunderstood. People avoid seeking help because they're terrified of what withdrawal might be like. But here's what you need to know. Withdrawal is temporary. It's manageable, and understanding what's actually happening in your body can make it less frightening. Let's demystify this. Withdrawal happens because your brain has adapted to the continuous presence of a substance. When you suddenly remove that substance, your brain is temporarily out of balance. Think of it this way. Your brain is always trying to maintain equilibrium, what we call homeostasis. When you repeatedly use a substance, your brain makes compensatory changes to counteract its effects. For instance, alcohol is a central nervous depressant. It enhances the calming neurotransmitter GABA and suppresses the excitatory neurotransmitter glutamate. Over time, your brain compensates by reducing GABA activity and increasing glutamate activity to restore balance. When you suddenly stop drinking, you still have that reduced GABA and increased glutamate, but now there's no alcohol to offset it. The result, your nervous system goes into overdrive. This is called rebound effect. This same principle applies to most substances. Opioids suppress certain pain and stress pathways, so withdrawal brings heightened pain sensitivity and anxiety. Stimulants flood the brain with dopamine and norepinephrine, so withdrawal brings profound fatigue and depression. Withdrawal symptoms fall into two broad categories, physical and psychological. Most substances cause both. Physical symptoms might include sweating, nausea, vomiting, diarrhea, tremors, muscle aches, headaches, rapid heartbeat, and changes in blood pressure. These are your body's physiological responses to the absence of a substance. Psychological symptoms can include anxiety, irritability, depression, insomnia, difficulty concentrating, and intense cravings. These reflect the brain chemistry changes we discussed in earlier episodes. The timeline varies dramatically by substance. In alcohol, symptoms can begin within 6 hours of the last drink, peak at 24 to 72 hours, and generally resolve within 5 to 7 days. However, some psychological symptoms can persist for weeks. Short-acting opioids like heroin produce symptoms within 6 to 12 hours of cessation, peaking at 1 to 3 days, and largely resolving within a week. Longer-acting opioids like methadone have a delayed onset and can take 2 to 4 weeks to fully resolve. Benzodiazepines, these can be particularly prolonged. Symptoms might not appear for several days, can peak around 2 weeks, and may take months to fully resolve. In the case of stimulants, the acute phase is relatively short, days to a week, but the psychological symptoms, particularly low mood and fatigue, can persist for weeks or months. This is crucial. Not all withdrawal is medically dangerous, but some absolutely is. Medically risky withdrawals include alcohol. Alcohol is the most dangerous. Severe alcohol withdrawal can progress to delirium tremens, a condition involving seizures, severe confusion, hallucinations, and autonomic instability. Without treatment, delirium tremens has a mortality rate of about 15%. It occurs in fewer than 5% of people with alcohol withdrawal, but when it does, it's a medical emergency. Benzodiazepines and barbiturates carry similar risks because they work on the same GABA system as alcohol. Seizures can occur and they can be life-threatening. Distressing but generally not life-threatening withdrawals can include the following. Opioid withdrawal is often described as feeling like a terrible flu. It's profoundly uncomfortable. Severe muscle aches, nausea, vomiting, diarrhea, anxiety, insomnia, but it's rarely life-threatening in otherwise healthy adults. The real danger with opioid withdrawal is the risk of relapse and potential overdose if someone returns to use after their tolerance has decreased. Stimulant withdrawal primarily involves psychological symptoms, profound fatigue, depression, increased appetite, disturbed sleep. It's distressing, particularly the depression, but not medically dangerous in the direct sense. However, there are important caveats. Anyone with underlying medical conditions, pregnant women, people withdrawing from multiple substances simultaneously, or those with a history of severe withdrawal should never attempt withdrawal without medical supervision. Even non-dangerous withdrawal can become dangerous in vulnerable populations. If you're considering stopping substance use, here's what you need to know. First, for alcohol or benzodiazepines, never quit abruptly without medical assessment. The risks are too high. Medical detox provides monitoring, medications like benzodiazepines for alcohol or a gradual taper for benzodiazepines, and immediate intervention if complications arise. Second, even for substances where withdrawal isn't life-threatening, medical support makes the process far more comfortable. Medications can reduce symptoms dramatically. Clonidine for opioid withdrawal, buprenorphine or methadone for opioid substitution, various medications for symptom management. Third, remember that withdrawal is temporary. It feels endless when you're in it, but it does end. Knowing the timeline helps you mentally prepare and recognize that you're making progress. Finally, withdrawal is just the first step. Getting through it doesn't mean you're cured. It means you've cleared the immediate physical dependence and can now engage in the real work of recovery. Withdrawal doesn't have to be a barrier to recovery. Understanding what's happening and getting appropriate support can make it manageable. But don't let fear of withdrawal keep you from getting help. If you find this helpful, subscribe to MedHeads for more evidence-based health insights. I'm Dr. Fergal Armstrong, and stay well.